All right, we'll do one more mic check. 1, 2, 3, 4, 5. And over here for questions. 1, 2, 3, 4, 5. We'll get started in about 5 minutes.
Good Friday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness at Knox County Health Department. Our moment of gratitude today is dedicated to our media partners who have been diligently covering our community's response to the COVID-19 pandemic. We know you all have also been working long, hard hours to get the latest information out to the public. We appreciate your work sharing factual information, correcting misinformation, and addressing the ways that our community can come together to reduce the impact of the virus in Knox County. Today's real-world example of putting the 5 core actions into play is using car ride shares or carpooling. When using any type of transportation where you will be sharing the vehicle with folks outside of your household, make sure you wash your hands before you leave and once you get to your destination. During your ride, try to keep at least 6 feet from people, and if you can't maintain the 6 feet of distance, make sure you are wearing a mask. You can even pack some sanitizing wipes to clean some of the frequently touched surfaces like door handles, railings, that kind of thing. If you're driving, you can open the windows or set the air conditioning on non-recirculation mode. That helps get fresh air into the car. It's also extremely important that if you're sick, to stay home and don't share a car with someone outside of your household. But if you are sick and need to share a car or vehicle to seek medical care, you wear a mask and sit as far away from others as possible. Now for a couple of housekeeping notes. We are testing today at the Jacob Building from 9 to 3 p.m. We will continue with the same schedule next week. Testing will be available Monday, Wednesday, and Friday from 9 a.m. to 3 p.m. at the Jacob Building in Chilhowie Park. Moving forward, beginning next week, we are moving our media briefings to Tuesdays and Thursdays. Benchmarks will continue to be updated on the website on Wednesdays and will be reviewed at the Board of Health meetings on Wednesday evenings. We will also go over benchmarks during our Thursday media briefing. We will provide additional information to our media partners this afternoon on media availability moving forward. And now we'll move into the local situation. We have 99 new confirmed cases since yesterday's report, giving us 5,134 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 183 probable cases. 3,077 of our cases have recovered, giving us 2,192 active cases. 229 individuals have been hospitalized at some point in their illness, and 33 of those Knox County residents are currently hospitalized. And we are sad to report 1 additional death related to COVID-19, bringing our total to 48. I'll now open it up for questions.
All right, the first question we have is from Alan with Inside Knoxville. It says, if it wasn't already clarified, please explain the flow of cases reported by UT into our local numbers. For example, were yesterday's UT cases counted in yesterday's Knox County totals, today's?
That really depends on a lot of factors, but they do get reported out. So whether, and let's talk first, it's about where they're physically living at the time. So if it's Knox County residents, so if they're living on campus or they're a commuter living in Knox County, they will roll into our numbers on the day they get reported to us, just like every other case. And the same goes if they are a commuter living in one of the surrounding counties, they'll be reported with that county's cases as they get reported within the state system as well.
From Megan with WBLT, is today's increase in active cases significant enough to break the downward trajectory Knox County has established over the past week?
I think we just need to look at, we don't ever say one day's a trend. We had a really low day this week, but things still seem to be relatively level, and we're happy with that. We ask that people continue to be diligent with the 5 core actions, though, so we can continue to see positive trends. So I think let's wait and see what happens over the next few days.
From Grace with WBIR, if UT is reporting cases twice a week, will that inflate your cases twice a week, or will they be spread out whenever the results come in?
UT's reporting of cases are UT's numbers that they're working in. Again, on for their campus cases. We will continue to report all of the cases that come into Knox County, just as we always did. So the numbers may look a little different because, again, there's people on UT campus that might live in Blount County that gets counted in Blount County's numbers as well if they're commuting in. If they're living on campus, they'll be part of our numbers just like always.
Also from Grace with WBIR, UT said they were awaiting guidance from the health department on whether net gators are effective. Have you all reviewed these studies, and what are your recommendations?
I actually bumped that up to the state yesterday because this is something that can impact a lot of places across the state, not just in Knox County. And the recommendation we got right now is, CDC and Johns Hopkins and other folks really recommend multi-layered masks are the best option for cloth face coverings. But as the state said, a gaiter, any type of cloth face covering is better than nothing. And I have not gotten that back to UT yet. So I just got that information, and you're the first to hear it. So that's where I'm right now.
Also from Grace with WBIR, Dr. Piercy said demand for testing statewide has dropped. Can you speak to that locally?
We have mentioned that we've seen a little bit of a decline. It has not been a huge amount, but there was a little bit of a trend down the past couple of weeks. And I don't have any more, information on why that might be. There's a lot of things that could factor in, but we have seen a slight decline here as well. We talked about that in our benchmark data as well on Wednesday.
From Jeff with WATE, can you share the age and gender of the new death?
64-year-old man.
Any other questions? Can you please go ahead and share them in the chat feature? From Grace with WBIR, when should people get tested and why is that important?
Lots of different reasons on that. So first and foremost, if you're sick and you have COVID symptoms, we recommend you get tested. So, fever, cough, shortness of breath, loss of taste or smell, all of those things. If you're a contact to a case and you want to get tested, we suggest that you wait probably 4 or 5 days afterwards to give the best chances for you to test positive. If you test too soon after your contact with a case, you might not have had enough time to develop enough of the virus in your body to react to a test. And so we do suggest you wait for that, but those are another group of people we recommend that get tested. And then if you've been in groups where you think that you might have been exposed, if there's been information circulating at your workplace or at your church or your school or anything like that, and you're concerned about exposures, that's the next group that we recommend get tested.
Also from Grace with WBIR, TDH is now releasing daily positivity rates. Any plans to share that locally? Why or why not?
If TDH is providing it, I think you can get it from them. We'll talk about if we are going to release it here as well, but I believe they're releasing it by county at TDH anyway.
From Jeff with WATE, do you have plans for another recheck of the data for duplicates, et cetera? If so, when and how often going forward?
We do it all the time as we're able to go back and do it and look at it when our staff has the capacity. As we're bringing on more team members to be able to do contact tracing and all of the things that go along with that, that is freeing up more capacity for that to be able to occur on a more routine basis with our epidemiology staff. And so we're very happy about that. It's not a set schedule. It's something that they pretty much try to look at as often as they can.
From Vincent with the Sentinel, can you explain the change in media availability? What was behind that decision?
We really wanted to line up with what's happening across the state. So in other metro regions and with the state leadership at this point in time. And then we can also have some media availability for you all, hopefully as well. But the main thing is to line up with what is happening across the state.
From Jeff with WATE, any updated plans for in-school vaccination clinics?
Not yet. Trying to get all of the other hurdles that come with getting into school over with and through all of those things, but still active discussions on what that look like, and we'll get it as quickly as we can out to the public.
From Brian Hornback, after your time with contact tracing and you are released, should you continue to test until negative?
No, we do not recommend that. The reason being for the PCR test, and this is a CDC and a Tennessee Department of Health recommendation. With a PCR test, there's very good chances that you can continue to test positive for a long time because it's looking for genetic material essentially that can still be in your body for a while. That doesn't mean you're still infectious though. There's a lot of evidence right now that has culminated at, really that 10-day period that the vast majority of people are infectious during, and then after that, really not anymore at that point. And so that's where those guidelines change from CDC and why we don't recommend negative tests to release you from isolation or go back to work or anything like that. We really focus on and encourage everybody to use that time-based strategy that CDC and Tennessee Department of Health and we follow.
From Megan with WBLT, when should parents keep their kids home from school?
If they are contact to a case, if they're a case, most definitely they need to stay home from school. And if they're exhibiting symptoms for COVID, or any other illness. If they have a fever and a GI bug, just like always, we ask that you keep your children home from school.
From Brian Hornback, can one that has been released from contact tracing immune from COVID in the future?
The time frame right now that we look at for that is about 3 months. That's guidance that we've received from Tennessee Department of Health and that they've gotten from CDC as well. That if somebody tests positive again, so they've been released and then they test negative and they're positive again, about 3 months that we would not put somebody back in isolation and quarantine. After that 3-month window, that's a discussion that we will elevate up to TDH and have that discussion with them. Look at all the circumstances that might have been involved and have a real thorough discussion to make a determination after that. But in general, most people, if it's a short turnaround time, no. But we don't really know. And the reason for that and where the discussions come in is we don't know how long that immunity lasts. There's evidence right now that's looking at about the 3 months window at least, which is where that recommendation comes from. But we don't know how much further than that we have.
From Alan with Inside Knoxville, any update on the review of the contact tracing after finding a case that was not traced? Have others been found?
We have not found any others at this point, but we have pulled back all the contact tracing to us and are continuing to fully investigate that, but no additional information at this time, but no other cases either.
From Grace with WBIR, can you explain why the positivity rate matters? How are you all monitoring that from the state?
So positivity rate does help when testing decreases to still know kind of what's happening and circulating within the community to let us know if our positive rate or our positive cases are not we're not getting those because of people not testing, or if there's actually decrease of disease in the community circulating. We have not, and we've said this a lot of times before, we haven't been using that here because we don't really feel great about the denominator data. It's on our website, all of that about not knowing that we don't see every bit of testing that is happening in the community. There's point of care testing happening in some places that the negatives aren't always reported. But in general, it's good to know because it helps us have an idea of really the true burden of disease circulating through the community.
From Jeff with WATE, we've seen recoveries back above the level of active cases. Is that a trend you expect to continue? And are you happy with the direction it's heading?
We certainly hope so. We want that to happen. And again, we continue to enforce those 5 core actions so we can see our metrics continue to move in a positive direction.
From Vincent with the Sentinel, with respect to answering media questions, how will the change in press conference timing impact our ability to get questions answered?
You're going to get an email with more information later today. I don't actually have all the details right now.
From Jeff with WATE, how was the response to the testing opportunities at the Jacobs Building site this week? Did you get the number of people expected?
Yeah, I haven't heard of any issues or concerns with that. And every day they've worked on process improvement and improved their flow to get more and more people in. So as far as I know, things are going well over there.
From Grace with WBIR has a follow-up to Vincent's question. The Board of Health has cautioned the situation could change quickly with schools and universities opening, Labor Day coming up. Will media briefings move back to Monday, Wednesday, Friday if the metrics begin to change?
If there's a need to do so, we will absolutely do so. Nothing ever stops us from having a media briefing at any point in time if we need to. And so, but again, to align with the regular routine briefings that are happening across the state, we're moving to a similar model.
From Claire with WUOT, can you give any information about long COVID? Have you seen many cases in Knox County with symptoms that continue on for months past the infection date?
That does happen. Some things like loss of taste or smell or a long lingering cough. Those type of things happen. I don't have the exact, we don't have the data exactly on how many of those there are, but I do know that we've heard of those. Typically, though, from all the metrics and research and reports that are out there from CDC on their guidance documents regarding the release from quarantine, the vast majority of people still are not infectious after 10 days, but there can be some lingering symptoms.
Any other questions? Please go ahead and submit them now. From Vincent with the Sentinel, why does it matter if Knox County is giving press conferences at the same time as other conferences statewide? We have Board of Health meetings every Wednesday, and the benchmarking presentations during this meeting help contextualize the conversations the Board of Health has every Wednesday.
we're working as best we can, and we have a lot of other work to do, and we've been moving towards being able to do other public health activities as well. So we also need to free up our time to do that and be able to do more than just COVID. Your access isn't going to change. You're going to get information. You're still going to be able to get your questions answered. We're just going to move to 2 days a week here at this point moving forward.
Any other questions? Please go ahead and submit them now. All right, not seeing any other questions come in, so thank you all for your time, and we will see you next week on Tuesday during the media briefing, and you can expect an email coming out this afternoon with more details. Have a good rest of your day, a good safe weekend.